All right, welcome to this magical session of the Somatic Nurse Coach certification course. We have Nurse Eva here today, and she's a yoga therapist as well as a nurse and extraordinaire in many different facets of alternative healing and medicine. So she's going to talk to us about sleep hygiene today. So I'm going to go ahead and hand it off to her. Thanks for being here, Eva.
Hey, thanks for having me. It's such an honor and pleasure to be here with you and all of your somatic nurses. Excuse me, as a yoga therapist, one of the things that, man, I wish that I'd had this information before even going into nursing school, because I think it would have really changed the landscape of, how I behaved and prevented burnout and all of the different areas in which sleep is just absolutely vital. And I don't know if you've ever heard anybody say, I'll sleep when I'm on vacation, or even worse, I'll sleep when I'm dead. You know, as nurses, sleep seems to be the first thing to go on our priority list. So let me share a presentation with you all. Make sure I'm doing the right screen. There we go. Okay, are you able to see that? All right, fantastic. Okay, so sleep hygiene. Let's talk about what that is. For those of you that haven't met me before, hi, my name's Eva Zobian. I'm a nurse, yoga teacher, yoga educator, and yoga therapist. So I have over 20 years of experience in the hospital setting. 10 of those years was in critical care. So, low stress, right? Like, no, not a whole lot of stress happening there. Charge nurse for a good portion of those 10 years. I'm a trauma-informed yoga therapist, and we'll talk a little bit about what that means. But I specialize in stress relief, stress management. I'm also an adaptive yoga teacher because guess what? Yoga is for everybody. It does not matter whether you are able to walk, whether you are able to run, whether you are able to jump. If you're not bendy, not flexible, yoga is still available for you. And I love being able to bring that to people and make yoga accessible. I'm also an education provider for nurses and yoga teachers. So a lot of the workshops that I teach are CE available for nurses and for yoga teachers. Okay, so what is the challenge? Why do we need sleep hygiene? The challenge here is nursing is a 24/7 profession, right? And it's different for every person. And it's different from day to night and night to day. Whether you are a night shift nurse, whether you are a day shift nurse, whether you work a clinical setting, not only is it different day to day, it's different from whether you're working, it's different from whether you are on your day off. Sleep is a challenge for a lot of us nurses. And the solutions for this need to be very specific to the person and be flexible, because a lot of things change in the day-to-day life of a nurse. So the goals for this are to be able to define sleep hygiene, to be able to identify 3 different benefits of sleep hygiene, and then identify 3 strategies to create a sleep conducive environment. And what does sleep conducive mean? Well, we're going to talk about that here in a moment. Introduction to sleep hygiene. May not be a term that you have ever heard before, and that's okay. Sleep hygiene is referred to as modifiable behaviors and environmental adjustments that can be used to promote sleep quality and improve sleep quality. When we talk about sleep quality, there's 2 things that really affect our sleep: our circadian rhythm and adenosine. We all sitting there thinking, adenosine, really? Absolutely. So circadian rhythm, right? This is our 24-hour cycle. Again, this is why we want to be very aware of our own personal needs? What is benefiting us? What is preventing us? This circadian rhythm is a little bit different for everybody. In fact, each person has a slightly different circadian rhythm in the amount of time. It's 24 hours, but it may be 24 hours and 15 minutes. It may be 24 hours and 50 minutes. It's different for every person, and it affects every area of our body. It is interacting with all of the different systems in our body, but it also extends out into how we interact in our life. So the sleep driver, the big push behind our ability to be able to fall asleep and to want to fall asleep, is adenosine. It's responsible for the desire to sleep, and it prevents us from having that ability to stay awake, right? So it's inhibiting wakefulness mechanisms. Caffeine blocks adenosine receptors. Now, here's the thing. We need 8 hours of sleep to be able to clear adenosine. So a lot of times people will tell you, oh, you need 8 hours of sleep. And we think it's this arbitrary number. But when we bring it back to the neuroscience, when we bring it back to the biochemical aspect, adenosine takes 8 hours to be washed out of our system. When that happens, then we are more fully awake. And if you've ever switched shifts, thinking, you're normally a day nurse and you have to work nights for a while, or the opposite, then you know what it feels like to walk through that haze of, I just can't be fully awake. So let's talk about the sleep cycle. We're awake, right? We're awake, we're interacting, we're paying attention. We also have REM. This is the sleep cycle that most people know the most about. REM is rapid eye movement. That's the space where we're dreaming. That's the space where we're actually very active. We're in a very active brainwave state during REM sleep. But then we have non-REM 1, non-REM 2, non-REM 3. There's different stages here, and each one has its own specific purpose. Now, sleep cycle. This is the big picture of sleep cycle. And this is why, again, paying attention, understanding sleep is so incredibly important, because we have multiple 90-minute cycles. We go through non-REM 1, non-REM 2, non-REM 3, and REM. We spend a specific amount of time in each stage. Now, here, when you look at it this way, we're in light sleep for about 5% of the night, deeper sleep for about 45% of the night, deepest sleep for about 25%, and then REM 25%. Here's where it gets challenging for nurses. We don't spend 5% of the night in stage 1 and then slip to stage 2. We go through these 90-minute cycles where we cycle through stages 1, 2, 3, and 4, and we spend a certain amount of time in each stage. As we go through our different cycles, we spend more or less time in specific stages, and those are very specifically structured so that we get the most healing, replenishing, nourishing, soothing removal of toxins, uploading of memory, decluttering of our brains, really anchoring in the things that are important to us and cleaning out our brain. That happens when we go through each of the independent cycles and allowing ourselves to be able to go through all of those cycles. So this is where sleep hygiene comes into play. When we have beneficial sleep hygiene, we wake up rested, we have more energy, right? It's protective against chronic illness. It improves the function of our brain. It increases our ability to have mood regulation. We have less of a stress response, improved satisfaction in our relationships, and this lengthens life expectancy. We're providing the space that allows for our body to do its own natural healing each and every night. So, one of the big strategies for sleep hygiene is developing awareness. What do I do that's helping me? What do I do that's not helping me? And two things that we can do are developing a consistent morning routine and developing a consistent evening routine. And again, these are going to be person specific, but they also need to be moment specific, meaning what's going on in my life right now that I need to change up my morning routine? Do I need to add more things? Do I need to do slightly different things? Am I traveling? Do I have a baby in the house? Do I have a puppy in the house? Do I have guests in the house? These are the types of things that allow us to be flexible and meet ourselves where we are. Okay, so coming back to quality of sleep. So paying attention, developing this sleep awareness is being aware. How easily do I fall asleep? Do I lay down in bed and boom, I'm out? Or does it take a while for me to fall asleep? Do I need to do movement? Do I need to listen to music? Do I need to have essential oils diffusing? Do I need to have all the lights shut off completely? What are the things that allow me to fall asleep easily? And then how often do I sleep through the night? Am I sleeping all the way through the night? Am I waking up periodically? Paying attention to these things and noticing our patterns, noticing our trends. If you're waking up every night at 2 o'clock, 3 o'clock in the morning, and then having to wrestle to try to fall back asleep again, that's a new pattern. And that's an opportunity for us to make some shifts in our routines. How often do you wake feeling fully rested? I will tell you, as an ICU nurse, the number of times that I woke feeling fully rested was probably counted on one hand, right? 10 years of working as an ICU nurse, the number of times that I woke up feeling completely rested, very few and far between. How often do you get a full 8 hours of sleep? Who does this? I only got 4 or 5 hours of sleep this night, so I'm going to get 10, 12 hours of sleep this night because I don't work the next night. That's called sleep debt, and we don't actually make that up. So paying attention to how can I get the most amount of sleep when I can. And again, remember, there's no judgment here. This is a space of kindness and love and compassion and non-judgment. So the goal here is to get that full 8 hours of sleep. However, this also understands that we're living a life and in a profession where this can be challenging. So how do we make the most of this with this knowledge? One of the things that we can do is develop an evening routine. Again, what is included in a routine? And when you're working with different clients, when you're working with different patients, we want to make sure that one of the things that is most important is that when we find things that work for us, we create this toolbox of these are the things that I know that work well for me. What is going to work today? What's going to work best? How many of these things can I put together to be able to develop my own personal sleep routine? So sticking to that routine as much as possible. Decreasing the room temperature, if you're able to. The cooler the room, and there's lots of different resources that we have for being able to do this. Now we have things like chili pads and different pillows and different sheets that can assist in this as well too, especially if you live with somebody that loves to keep the temperature at a higher temp than you do. um, dimming the lights earlier in the evening, and using blue light protections as much as possible. One of the things that we do is we have the color change light bulbs in our, we have an open floor plan. And so we have the color change light bulbs in as many spaces as we can. And at a certain time in the evening, they shift to more of a reddish hue. And then when it gets to be right before bedtime, they shift completely into red light. So we always joke that we're going into our submarine mode, because that protects against that blue light that keeps us from being able to fall asleep effectively. Plan your transition for your days off. This was something that, again, when I worked in the ICU, this was really challenging for me because I did work nights. And so by the third night, I would just be in really different and shifted in my sleeping pattern. And my plan was to sleep during the day, get a few hours of sleep, wake up, do the things that I needed to do, and then get a full night of extra sleep in the evening. So here's a strategy that you can use is to nap when you need to. Now, 20-minute naps are phenomenal. They're enough of a nap to be able to get you that rest without going into sleep inertia or going into a full sleep cycle. Because if we wake up in the middle of between 20 minutes and 90 minutes, we're in those sleep stages, and then we get what's called sleep inertia. So a strategy that you can use is something called yoga nidra, and this is a systematic method of deep relaxation that has been shown to take you through a lot of those stages of sleep to provide that healing. 20 minutes of yoga nidra has been shown to be as beneficial as 2 hours of deep sleep. So you can use a meditation like yoga nidra that helps you to get some of that healing, get some of that calm, and be able to assist in that process of calming the body. So developing strategies for sleep challenges when you know you're going to be traveling, you know you've got visitors coming into the house, or you have a puppy, or you have multiple children. What are the strategies that you can use? And again, this is all said with kindness and compassion and non-judgment. We do the best we can with what we have going on in our life and making sleep a priority as much as we're possibly able to. One of the things to pay attention to is, again, consider your caffeine and your alcohol intake, because alcohol actually prevents us. We feel like it calms us down, but it actually, again, prevents that adenosine circulation, that removal. Morning routine, same thing. We want to stick to our routine as much as possible. So again, paying attention to sleep inertia. If you're somebody who hits the alarm clock multiple times, that actually is going to wake us up in the middle of those sleep cycles again. And that creates that grogginess that actually takes like 2 hours to be able to navigate through that sleep inertia. I have been a night nurse almost my whole entire career. And when I first transitioned to the ICU, I had to work days for 9 months. And that is the only time that my husband ever looked at me and said, "You ever stay on days, we're getting a divorce." He's like, "I need you to go back to nights, like now." And he is the most kind, compassionate patient person in the world. So I knew it was bad when he was just like, no, get back to nights. Um, and the reason for this is because of the sleep inertia. Is it took so much for me to wake up at that early time of the day, and that sleep inertia was something that I was combating the entire, like, all the time. Morning sunlight. This is something that is cheap. It's free, right? And it is something that we have accessible to us all the time, even if there is no sunlight, right? You're living up north, it's the middle of winter, and everything is gray. Still, stepping outside for 5, 10 minutes, no glasses, no sunglasses, stepping outside and getting that sunlight into our eyes, it creates that biochemical response that stays with us throughout the day and helps us to develop um, plentiful amounts of serotonin as well as melatonin that help us to be able to fall asleep. Make sure you're exercising regularly. It doesn't matter what the exercise is. It can be doing squats once an hour, set a timer, do 30 squats every hour. It doesn't matter what the exercise is. We just need to be exercising regularly to get that blood circulation going. And then again, nap when you need to. Using it yoga nidra meditation. There's so many fantastic meditations that are available, free apps that can give you meditations. And pay attention to your food intake. And I say this because when we nourish our bodies, we're nourishing the processes that allow us to be able to go through all of our sleep cycles. Okay, so how do we integrate yoga therapy into daily activities? Breathwork. Breathwork, again, it's free, it's available. You have it with you everywhere. So you can use this in between patients, in the elevator, in the med room, during your breaks, if you get breaks, anything that allows you to focus in on the nervous system is going to assist you in your emotional regulation. 4-7-8 breathing is one of my favorites. Inhale for a count of 4, hold for a count of 7, exhale for a count of 8. This is a phenomenal breath practice that you can do while you're trying to fall asleep. Equal breathing, 4 count in, 4 count out. Now, I will say that if you have a heightened nervous system, you have a highly activated sympathetic nervous system, you may need to start with an equal breathing that is a 4 count inhale and a 6 count exhale. And the way to know how this feels for you is, if does it feel balancing? If it actually increases anxiety, just lengthen the exhale a little bit. Diaphragmatic breathing, this is increasing vagal tone. We're massaging the vagus nerve when we use diaphragmatic breathing. So pulling our breath all the way down into our belly and really expanding and lengthening the diaphragm. The diaphragm has the ability to stretch up to 4 inches. And using practices like pause. The practice of pause is when you feel overwhelmed, stop. The P is for stop, pause. Stop what you're doing. The A is for assess. Assess what's happening. What do you feel in your body? What feels out of control? What feels excessive? What feels missing? And then use your resources. Use the resources that you have available to you. What are the things that you know? What is something quick that you can do? Something as simple as hand to the heart and hand to the abdomen and just breathing in and paying attention. That is a really quick, incredibly accessible tool to bring calm, balancing into the body. Things like meditation, reflection, journaling. All of these things allow us to be able to look into what are my practices, what are the things that I do, and how beneficial are they? And then self-care. Here's something that we were talking about last night that was really just profound. We hear this all the time. You can't fill from an empty cup. Well, one of the things that my mentor says is we should always be trying to fill our cup. And what's in our cup is for us, right? So if I only fill my cup to 30%, that means I only have 30% of myself to give. But if I fill my cup all the way, then I am completely nourished. I am completely filled. And if I am still continuing to try to fill the cup, whatever spills out, that's what I have that's I can give to everybody, and I'm giving from a space of I'm at 100%. My battery levels are at 100%. So when we think self care, we want to think of filling that cup as much as possible so that it's overflowing so we have lots and lots to give. So, quick recap on this things that we can do: develop awareness. What are the things that are helping you? And really taking a good look around at your spaces. What is nourishing for you? What is helping you? What is preventing sleep? Anything that we do with ourselves and with our clients needs to be person centered. It is not a one size fits all practice. This is very person specific, and it's also week to week specific, right? So are you working night shift? Well, how you handle your sleep is going to be very different from you being on vacation, you being on your days off. Developing those morning routines, developing those evening routines, things that you can do to really just lock in that neuroplasticity. When you do the same things over and over, when you start to go through your routine, your body and your brain recognize that and say, oh, now's the time to get sleepy because we're starting. Same thing that we do for little kids. We need to be doing that for us. All right. So I just want to say thank you. My name's Eva Zobian Wolf. You are welcome to follow me on social media. I leave all kinds of tidbits on sleep and movement and breath work periodically. I am so thankful for you, and I would love to take some questions.
Yay, dude, that's so good. Thank you for
Mhm.
presenting that. I really had a question about the sleep cycles because I've learned a little bit about the sleep cycles, but I didn't know that we cycle through. So we cycle through them multiple times, all those cycles multiple times a night.
Yep, exactly. Yeah, we go through them multiple times, and if we only go through two sleep cycles, the amount of time that we spend in a certain stage is different each time. And some of the really strong benefits in terms of healing, rejuvenation, memory retention, those happen in the later cycles.
Wow.
And yeah, I mean, finding that out, I was like, oh my gosh, I am totally guilty of being that person that would get 4 to 5 hours of sleep a night and then just crash and sleep for 12 hours
Yeah.
and think, okay, I'm good.
Yeah.
And this was a big contributor to my burnout. And so learning more about sleep, and it's one of the things, we have those, what's the buzz research right now. For a long time it was smoking, and then after that it was um I don't even remember. But sleep was a big portion of the research a few years ago. Dr. Daniel Amen, I don't know if you follow him.
Yeah. Yeah.
This is one aspect that he talks about a lot because the blood perfusion that we have in our brain, it has to do with our ability to be able to clear out toxins and to clear out the junk in our brain. And that's what happens in our sleep. We're literally we're decluttering our brain while we're sleeping.
That is so cool. That's so cool to think about. Like I can imagine like little sweepers just like going in and like, like cleaning it out. Like that's
It
so
is
cool.
too. It is like that. That's, we're Marie Kondoing our brain
Yeah.
every single night. Um,
I love that.
because the thing is, like, all the things that happen during the day, our brain in the middle of the night is basically shuffling things around and saying, okay, this is junk, brings me no joy. I don't need to keep this. And then it's shelving other things and saying, no, we're keeping this memory, we're keeping this knowledge. That's something that we're going to want to reference later. And then, this is just trash and throwing it away. And we see that when we get multiple nights of really good quality sleep where we're thinking clearly, we're putting connections together, we're able to have good memory recall. And when you bring it back to trauma, it's our ability to be able to be more flexible and to be able to be more resilient, right? Where we
Yeah.
don't get as reactive. And that really ties into like more of the limbic brain and our ability to have a overactive amygdala, or if we have a more calm limbic system. And this is where I get nerdy. The
Yeah.
neuroscience of this just absolutely fascinates me.
Yeah. Well, yeah, it is. It is so fascinating. And we're still learning so much about the brain and the nervous system. And yeah, it's mind blowing. And I really think it wasn't until I started learning and understanding how to regulate my nervous system that my sleep did become better. So I think that, it goes hand in hand. If your nervous system's frazzled when you're trying to get to sleep, obviously you're going to have restless leg syndrome and you're going to have these things shooting through your body because your body is in a state of fight or flight still. So your legs are like and you're like, oh wait, I need a pill because my legs are restless. And it's like, well, hold on. Maybe you need some sleep hygiene. Maybe you need a little meditation before bed. Maybe throughout the day, you need to become aware that of your breath, of different aspects, right? Like it's not all of a sudden you get to 9 o'clock and you're like frazzled throughout the day and you're like, okay, I'm ready for my meditation. It's like a something that has to develop a keen awareness, right? Like throughout the day. Like
And
I'm
it's so
frazzled.
interesting that you bring up restless leg syndrome, because with my scoliosis, that's one thing that I do get is this
Yeah.
restless leg. My husband always jokes, he's like, you need to go running or you need to do something. And I'm like, why? And he's like, because you were running a marathon in bed last night. And I would notice that day one when I worked, I wouldn't have that many issues. Day two, maybe a little bit, but day three, it would kick in as I was driving home, where I'm in my car and my leg is just, I'm having to pound my leg into the footboard of the
Yeah.
car because I'm just getting these urges to kick nonstop. And when you put those things together and you notice, hey, this only happens when I'm unbelievably exhausted, then you start to make changes in your patterns and your habits, and you do things like, okay, I'm going to be more protective of my sleep between day 2 and day 3 because I know I'm already going to be exhausted.
Yeah. 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 And I think you make a really good point. I think we see an increase of RS, RLS, I guess that, yeah, RLS or restless leg syndrome, with TBIs, with people that have some sort of spinal cord like impingement or impediment, right, where the nervous system would be affected by the spinal cord. So I think that population and even yourself, you're a little bit more vulnerable to the nervous system being a little bit more erratic because it's already been kind of right moved around, shuffled. Maybe it's, getting pushed down on a certain part of the spinal cord, right? So yeah, absolutely. It's really interesting and it's like, yeah, it's like a release of energy. Like you were saying, you're like pushing your foot into the floor. And yeah, it's like energy is unable to escape almost.
Yes.
Yeah, yeah,
And that's the thing, is we're energetic bodies, and so being able to work with that energy is absolutely vital. And when we know that what we're doing is increasing energy in a particular way, we're not providing that balance to the energy.
yeah,
And so, yeah, it's sleep is a way for us to calm the energy, bring it back to balance, and it allows us to be more fluid. Or we're
Yeah.
easy, it's more easygoing. It's easier for us to just, go with the flow of what's happening versus feeling like we're stuck in a rapid all the time, or
Mm.
the opposite, where we're in this stagnant, scummy pond and we're just,
Yeah.
stuck in a particular spot.
Yeah. 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 Absolutely. Yeah. That energy and recharging, like you said, with the 20-minute naps. I love 20-minute naps. I have a Joe Dispenza. It's like 19 minutes and 26 seconds. And it's like, you've probably heard the meditation. It's like, feel the space around you, feel the space above your head. And I'm like, and then I wake up and I'm like, oh my God. And I feel so good. And I'm like, and then stuff starts manifesting in my life. And I'm like, oh, this is so cool. It's like that subconscious reprogramming, the nerdy stuff that we like to talk
Yes,
about.
yes. Oh my God, I love Joe
Yeah.
Dispenza. Like
Yeah.
his information is just, it's so beneficial. And I think that if we could apply this into more areas of healthcare, we'd have so much more um, people being able to feel in charge of their own health.
Yeah. Yeah. Absolutely. Yeah.
And sleep is something, we spend thousands of dollars on sleep. And the thing is, sleep medications,
Yeah.
they all have side effects, and none of them, not a single sleep medication, is able to mimic all of those stages of sleep.
Wow. So you're like missing out in some
Oh,
sort of way.
absolutely,
Yeah.
absolutely. Yeah. And the thing is, I mean, gosh, I had a doctor that I worked with that absolutely refused to prescribe Ambien because she had
Wow.
taken it herself and woke up in the middle of the night, and she was laying in bed surrounded by empty tuna cans.
Oh
And
my
she was just like,
gosh.
what is happening? And she said, it's the Ambien drunk, right? Like
Wow.
your Ambien drunk dialing, your Ambien sleeping,
Yeah.
um and I say this with absolutely no personal experience of Ambien. This is, purely what
Right.
somebody is telling me. But when you go through and you look at the pharmacology of medications and you look at what are the benefits versus what are the risks, yeah, the benefit is they help you to be able to fall asleep, or they help you to be able to stay asleep longer, but the quality of the sleep is never as good as natural sleep. And
Yeah.
the issue there is, how do we help people, yeah, let's give them the medication so that they are able to get some sleep, and also provide them the tools and the resources to develop the awareness, the morning routines, the
Mhm.
evening routines, to do the practices that allow them to get natural sleep.
Yeah.
And when we combine the two, we combine medicine and yoga therapy, practical behavioral changes,
Yeah.
we get there eventually.
Yeah. Absolutely. Yeah. It takes time. It's not a pill.
Right.
Even that is not a quick fix. Even there's some side effects towards, possibly taking that. Yeah. That's interesting.
Absolutely.
Wow.
Absolutely. And so yeah, like I don't advocate that people not use their sleep medications, but
Right.
instead, how do we assist them so that they're working with their physician, they're working with their provider, so that maybe they can lessen the dosages, or they can maybe potentially come off of it. But developing those practices throughout the day, and also the mindset in which they walk into their bedroom, that I am going to fall asleep, I am going to have this nourishing sleep, and creating the spaces that are conducive to that is incredibly important.
Absolutely. Yeah. The blackout curtains, the sleep mask, like all the whatever you need, right?
All
It's
the
like different for everybody. But yeah,
Yep.
one thing I love is especially if I've been on the computer for a long time, I just get tired. I get like a little bit of a tension headache. I have this eye mask that I got on Amazon. It was like the best $80 I ever spent, but it massages, it heats and vibrates like your face. And I do fall asleep and it plays music, or you can hook it up to a Bluetooth and meditate, right? So yeah, that's like the gift I buy now for like all my people that are on the computer for a long time, which is like everybody like at this point in life, or where they have that strain. So yeah, it's like learning about yourself and learning the tools and the tricks and the tips that help you the most, because everybody's different. And yeah, and it's okay. Like if you need the sleep meds, like that's cool, but definitely like have a discussion with your doctor, like, hey, what are other things I can do? And you might be surprised of their answer. They might not even have an answer or even know the answer. So that's where you can hook up with people like Eva here, Nurse Eva. She has a lot of good answers about sleep hygiene. So thanks for being here today and sharing this ultimately wisdom with us. Like it's the best human wisdom for today, especially with V Day. Like it's a lot of self-love. So give yourself some sleep, right?
I love it. I love it. Yeah, absolutely. And, well, this is one topic that I love to talk about. It's that yoga nidra meditation is one of my absolute favorite meditations, and I talk about it all the time. Got an AirPod that's trying to go its own direction in life. So, one of the joys in life, I have atypical ears, and so
Yeah.
they don't like anything in there. Anyways, but yeah, happy to talk about this anytime. It's one of my loves is sharing this knowledge because we go through nursing school and they tell us make sure you take care of yourselves, but they don't say,
Yeah.
okay, this is what it should look like. This is what happens when that doesn't happen, or so many aspects of it. So yeah, happy to chat anytime.
Yeah, awesome. Well, thank you so much for being here. And yeah, we hope you have a good day.
Thanks, you too.